Welcome to Behind the Clinic Doors, the Foot Health Podcast, the place where we lift the lid on the weird, wonderful, and downright inspiring world of foot health. Today, I'm joined with Joseph Frenkel, podiatrist and academic with an interest in dermatology and wound care. Joseph, you've worked across both clinical and academic settings for nearly 2 decades. What drew you into focusing on podiatric dermatology, specifically the
It's
skin,
quite
the foot, and lower limb?
quite a mouthful. Thank you for having me on, Gaynor. And two decades makes me sound quite old.
Oh, you're not,
So
no.
I was I was drawn to dermatology for a number of reasons. The first reason was my own ignorance. So we know that podiatry and foot health practitioners spend a large proportion of our time focusing on skin and nails,
Yeah.
yet we don't have any real formal training within dermatology.
Yeah.
So I found myself clutching at straws in some cases where you'd see a skin lesion or a nail complaint and you're like, that doesn't quite fit the box. So my ignorance and also my natural curiosity just to see the variety of things that can go wrong with the lower limb. So it was a natural interest, and that led me down some of my academic pursuits, particularly a master's of science with a focus in wound healing and tissue repair, which actually I was actually the first Australian to travel over to Cardiff University to undertake that. So
Wow.
that was quite interesting. It's Melbourne to Cardiff is a long way, about 3 flights worth, but it was really interesting to connect with different health professionals and yeah, really kind of build on my knowledge from that. So
Why
yeah.
why did you travel over to Cardiff?
It's a good question. There is a wonderful course here in Melbourne,
Yeah.
but because of timing issues and a few other issues, it just kind of didn't. It just matched up better to do it through Cardiff Uni. So shout out to them. That's part of my academic work is through Cardiff University. So a bit of a shout out to them. And what I liked about the way their course was structured was the subjects were sequential, meaning that you would do one subject at a time rather than the classic university model of three, four, five subjects simultaneously.
Okay.
So I really did like that we were literally building layers, much like the skin, we were building on layers. So yeah, it just ticked all the boxes, basically. Yeah.
Oh, good. What are the most common skin disorders that you see on the feet and lower limb? So, like in the legs, that
Yep.
people are.
Yeah. Oh,
I
well,
suppose that people often dismiss for minor dry skin or athlete's foot. So,
yeah. Well, I mean, obviously, athlete's foot is super common. I mean, if we say statistically speaking, tinea pedis has a lifetime prevalence of around 70%, which means that people have a 70% chance of contracting it at some point in their life. And for those of us that have been or live with teenagers, they know that it's more like 170%. But as you touched on, dry skin is really common of the feet and of the lower limbs, and in particular, it's not as if the anatomy is different the further down we go. I mean, we know feet are different anatomically, the way they're shaped, the way they function. But one interesting feature, and this is particularly relevant for systemic conditions like diabetes, because they're the furthest point, skin conditions manifest differently on the legs and on the feet. The furthest point meaning that the blood vessels and the nerves and the muscles all change as we literally move downwards away from the heart. So, for example, you won't see someone with cankles of the wrist, but you'll see it
wow.
around the legs because of the way that the structures change. So, yeah, we do see, I mean, the same skin conditions and nail conditions that we see in the upper limb, we see them in the lower limb as well. They just manifest differently.
Manifest
So, for
differently.
example, take eczema. So, eczema, for example, can be a global condition in the sense that it can be anywhere on the body.
Yeah.
But when it's in the feet and in the legs, it's a little bit different because of those other variables at play and
Yeah.
those anatomical changes.
And that
Yeah.
would be the blood flow as well, would you say,
Correct.
down to the
Correct.
feet?
Correct.
Yeah.
Yeah. Yep. Absolutely.
Are there any particular rashes or lesions on the lower limb that actually signal a systemic issue?
Yes, there can be. There can be. So, as we touched on before, like a condition like edema. So that's basically swelling of the lower limb,
Mhm.
and that can manifest in a particular type of eczema called venous eczema. And that can be indicative of something systemic. So that means that if we're getting some sluggish blood return back up from the legs because they're swelling or because there's an eczema type reaction, it could mean that there's something going on in a cardiovascular sense.
Yeah.
Similarly, we touched on diabetes before. So diabetes is an endocrinological, so it's a hormone condition that can have systemic effects, and we know that people with uncontrolled diabetes can get lesions on their shins, diabetic dermopathy. The skin can change. They're at a much greater risk to ulceration. So when we as podiatrists and foot health practitioners look at the leg, we do ask basic health questions. Is there anything you're suffering from systemically? Are you on any medication? So we do need to take a bit more of a systemic look at everything. And I mean, even something as simple as chronic warts, for example. So we know warts, also known as verruca,
Yeah.
they can infect on hands and feet. But if someone is getting an excessive amount of warts, that could be indicative of some sort of systemic immunosuppression. So their immune system's a bit down, and that's why they keep picking up infections like that. So a lot of it actually just comes down to basic medical history, asking our patients, is there something that's going on that could be contributing to this?
Yeah, yeah. And I suppose it's important that if there doesn't look like anything significant, it could be contributing to this, to then refer on
Correct.
for further investigations as well.
Absolutely.
Yeah,
Absolutely.
yeah. Nail changes can be subtle. Which signs, color, texture, thickness make you suspect something deeper, um, and it could be more dermatological a problem?
Yeah. Great question. So it all depends on what the nail condition is. I mean,
Mhm.
interestingly, there's a huge proportion of the population who never see their nails because they're forever covered in shellac or, oh God, actually I won't. Maybe I
No,
will
it's
go there.
right.
Do you
No,
know?
no, go into
Yeah.
it. I
Do you know
think it's
what? Do you
relevant,
know what?
absolutely relevant.
Well,
Yeah,
I'll ask you a question, Gaynor. Do you know what shellac is?
yeah,
Do you know
nail
what shellac
varnish.
is
Yeah,
actually?
gel nail
No,
varnish.
no, it's not actually. Well, it is. Sorry, but do you know what it's made of?
Actually, I don't. I don't because I actually don't put a lot on my toenails for reasons of I
Uh,
like to see what's going on.
yeah.
So the
So
gel, yeah, I have it on my nails. Not that I've got it on now, but yeah, my
okay.
toenails is very no.
So shellac is made from crushed beetles.
Okay. Learned
Yeah,
something new.
yeah, quite. Just Google that. I mean, if you're a vegan or that way inclined, not necessarily a good thing to put on. But
But a lot of us wouldn't
yeah,
know that. So I did
right,
not
right.
know.
I know. So yeah, nail change is interesting. What I look for, aside from the obvious signs, thickening, texture, discoloration, I look for symmetry. So what do I mean by that? I mean, if are all the nails infected or just one or two? So if all the nails and even the fingernails are affected and changing, that means something systemic is going on.
Okay.
So either it's something like psoriasis or it's something immunosuppressive going on because it is possible to have all 20 nails infected with fungus, for example. But if it's only one or two nails, there's often something local going on. So it's a local infection or it's trauma. And trauma is commonly from poor fitting shoes. There's a really simple experiment a simple test rather, that we were taught at university, which is to trace the shoe, an outline of the outer sole of the shoe, and to trace the person's foot. And incredibly, many people wear shoes that are just smaller than their feet.
Yeah, so
So
small.
ill-fitting shoes are a critical factor when it comes to nail health.
I see that in a lot of my elderly or elderly clients. So they don't like to change their shoes, and they've had those shoes for so long. It's something I could keep repeating, but you do see
Yeah.
it a lot, and you do see a lot of damage to the feet because of those shoes. But they
Mm.
somehow find them comfortable. But I think your feet end up
Yeah,
fitting in that space, and that's the problem.
absolutely. Yeah, absolutely. Yeah.
Yeah. Do you find that skin conditions on the feet respond differently to treatment compared to other areas of the body?
They do. They do. So if we focus a little bit more on the anatomy of
Yep.
of the foot in particular, so the foot is the skin is thicker. It's got a higher density of sweat glands. And so that means that extra moisture and that extra thickness means that the formulations we choose need to be a little bit different. So, for example, if we take a general body moisturizer, that's a lotion that's quite
Yeah.
thin, the low fat content of that means it's not really going to penetrate deeply on an area like the heel. So you need more of an ointment or a balm to really get in there.
Hmm.
Similarly, there's ingredients we use to break down hard skin called keratolytics because the main um, chemical portion of hard skin is keratin. So we need something to lysis means to break down. So a keratolytic is something that breaks down hard skin. So we often need a higher percentage of a keratolytic. So for example, if we had a really calloused heel, we'd need 15, 20, or 25% urea rather than a 5% urea or just a general kind of sorbeline, glycerin type moisturizer. So yeah, we do need to personalize somewhat, which is a little bit annoying because if you're kind of like a low maintenance person like myself, I
Yeah.
just like to use one or two, we do kind of have to go, right. I mean, if we're thinking from a sort of female beauty perspective, you need your cleanser, your toner, your, face moisturizer, your body moisturizer, and you do need a foot moisturizer. I
Moisturizer,
mean,
yeah.
depending on your foot condition, yeah. But the good thing is, and with all skin conditions, once we get a good handle on them, we don't actually need to use a heap of product forever. Meaning, like let's say you're prone to calloused or cracked heels. Once we get them under control through a combination of using a good keratolytic moisturizer and seeing your foot health professional to take off all the callus, maintenance is much easier. And that could look like
Mm.
3 times a week applying a moisturizer and seeing your local podiatrist, chiropodist, foot health practitioner every 2 months, let's say.
Yeah, it
So,
can,
it
can't it?
doesn't have to be a obsessive, got to get out my little pumice stone kind of thing every day. And actually, interestingly, over treatment is something I see quite often, particularly when it comes to nail pathologies. There's a condition called here. I'm going on a bit of a rant now, Gaynor.
No, you carry on because it's really, really interesting. No.
Yeah, well, there's a condition I see pretty commonly called onycholysis. So, onycho means of the nail, lysis means to lift. And so, people who excessively clean underneath their nails or pick away at it or get too many pedicures, they actually start to detach the nail plate, which is the top bit from the nail bed.
Yeah.
And so sometimes the nails can quite literally peel off, and it's a wonderful portal for infection. So sometimes, you've just got to help your skin help itself to not really attack it too frequently, but just really, put it in a position to help itself. Yeah.
Yeah, no, that's really important because you see that happen quite often. I see quite a lot of young girls actually for that reason, and that's just overdoing it with with pedicures,
Mm.
really, isn't it? So it's just good to
Yeah.
let your feet
Yeah.
have a break.
Absolutely.
So we have
Absolutely.
touched on this like next question a little bit. How do factors like tight footwear or long hours in boots affect the skin barrier and lead to problems? We have touched about tight
Mm.
footwear just a bit, but
Yeah, yeah, we did, but interestingly, I mean, it's not necessarily the footwear itself, but rather it's footwear as a whole. So, if we compare the anatomy of the foot to its to the hand, for example, imagine a person wore gloves from 7 o'clock in the morning till 10 p.m. at night, right? Their hands would be pretty gnarly. It's the same thing that happens on the foot.
it is.
And so it's the enclosed environment from any footwear really that impacts the way the skin barrier works, but it's also hosiery and socks. So if you think about a professional working in a big city who's wearing, let's say, tights, for example, or stockings,
Mhm.
they're predominantly made of nylon. Nylon's plastic. The foot is mostly moist because of the increase in sweat glands in the area, not to mention all that dead skin. So, not to go all gross, but effectively you're marinating an
Yeah.
area for 12 plus hours. Like it's pretty awful if you think about it. I mean, like let's say you feel like having a barbecue over the weekend, you got to marinate that,
I
big
know it
old
is.
rack
You just
rack of lamb. Right, but
yeah.
but 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 think about that, right? So it's the footwear itself and it's the socks and hosiery itself. So generally, what I advise my patients, and this is just general advice, just ventilate your feet for 8 hours a day. So a third of the day, And that, by the way, includes when you sleep. So you don't, ideally, one should try not to wear socks to bed, but any opportunity you have for ventilation, weather depending and social setting depending,
Yes.
is better for restoration of that skin barrier. So particularly for teenagers that can get quite sweaty.
Yeah.
Hyperhidrotic is the medical term. So if there's an opportunity to ventilate, again, social setting and weather permitting, we're just coming into the summer period here in Australia. So
Yeah, we're
there's going to
we're
be a
coming
lot,
into the autumn here, so
right?
you want to wrap up
Yeah.
naturally, don't you?
Yeah, no, no, of course, of course, of course. So yeah, but yeah, footwear's part of it, but so are hosiery and socks. So wherever possible, try to wear breathable materials. Some of the natural materials tend to be better, cotton, bamboo, etc.
Yeah, yeah,
Different people find different materials work better for them, but often it's also about rotation because we can't. I mean, depending on our jobs and our activities, alternating what we wear on our feet, so whether that's our hosiery and socks as well as different styles of shoes, can make a big difference as well,
yeah,
particularly for women, because um, uh, the proportion of women that have footwear related issues is significantly more than men, and that's purely about footwear and hosiery. So
yeah, yeah. It would
yeah,
be, wouldn't it? Yeah, yeah.
yeah.
Fashion, it's definitely
Yeah, I
that's
mean,
the problem,
it's,
isn't it?
yeah, unfortunately it is.
It is,
Unfortunately
it
it is.
is.
Yeah.
If you could bust one myth about foot and skincare that you keep hearing over and over again, what would it be?
Oh gosh. I mean, one I hear quite often is that, by urinating on your foot, you can cure tinea. I don't know.
Yes, I've
Have you
heard
have you heard that one?
that. You need to use urea cream. What? Urinate on my foot.
Yeah, that's it. Yeah. Well, I can't quite clear my rash, even though I've been peeing on my foot when I'm in the shower. Yeah, no, that's definitely a myth that I love busting. Urine belongs in the toilet. But yeah, no, that's one. And the reason it doesn't work is, well, firstly, what makes you so sure it's tinea? It might not be tinea, it might be eczema, which will be irritated by
Yeah.
by what you're putting on it. And secondly, it hasn't got enough of an antimicrobial, antifungal, or acidic effect unless you basically don't drink any water and then the pH of your urine changes. But no, that's definitely a myth I love busting. Definitely one. And speaking of which, on the topic of things you should put on your feet, one thing a lot of people don't do is they don't actually pick up their foot and wash it adequately in the shower. So
You're
what I
right
tell
there.
my patients
Yes, you're
is,
right.
yeah, because it's sort of, a basic question I ask. So getting back to sweaty teenagers, a basic question I ask is, how long do you wash your feet when you shower? And the most common response is, "Why? I don't need to wash my feet. I've just got soap all around me and I'm standing in it. And
Yeah.
why do I need to?" But many of us don't actually physically pick up our foot and wash it top
Washing,
to
no.
bottom in between. Yeah,
You
and
think
so
that they think that's
here's
enough, the water running down, don't they?
correct. It's not the same. So here's a little bit of a home experiment for all the listeners tonight when you're having a shower, or tomorrow morning whenever you decide to shower. Pick up your foot and wash each foot for 20 seconds, which is the equivalent of the chorus of a song or singing Happy Birthday. And you'll notice how
COVID.
different your feet happy, etc. Yes. But you'll notice how differently your feet feel after physically picking it up and giving it a wash top to bottom, in between, around the nails. I would say it's the foot equivalent of flossing one's teeth. It's something that many of us just do as a cursory kind of, quick little thing, but it's really something we should spend a bit of time on, and it really does make a difference to the way the foot skin functions. So keep it clean, everybody. Basically, is my advice on that.
And the no and the non-washing with your feet, that builds up the layers of skin. So we're not removing any dead skin cells. Is that right? Or
It is. I mean, skin naturally sheds anyway.
yeah, yeah.
So the idea of exfoliation, there is some conjecture as to whether that's necessary in certain skin conditions. So we're going a little bit beyond the foot, but it does actually manifest in the leg. Certain skin conditions like keratosis pilaris.
Uh-huh.
So that's where people have, particularly on the back of their arms, or they have it on their thighs. It's also known as strawberry skin or chicken skin, where basically it's a very minor form of callus that sits around a hair follicle.
Yeah.
So by exfoliating that with a bit of a loofah or even with a keratolytic like urea, you can kind of loosen all those things up. So yeah, so good hygiene does help,
Okay.
naturally remove some of those top damaged layers of skin. But I mean, we haven't even touched on cleansers. I mean,
No.
many people don't realize that, for example, a cleanser, not to name and shame, but a cleanser like Dove, where they say it's the same, pH as water, that's not ideal actually, because
Okay.
skin pH, so the pH is a measurement of acidity. So 1 is highly acidic, 14 is highly alkaline, 7 is neutral. So water is neutral, for example.
Okay.
Skin pH sits on the acidic spectrum, and it sits on the acidic side of that scale purposely as a natural antimicrobial feature. So if we use a soap that doesn't promote acidity of the skin, we're actually putting ourselves at a slightly higher risk of infection. And
Okay.
so, one thing, aside from advising my patients how to actually wash their feet well, I do advise them to use a low pH soap. So, they're not the ones you typically get at a supermarket, they're the ones you'll
Yeah, that's
typically
good.
get from a chemist or a
Okay.
pharmacy. And there are some good brands out there. I'm not sure what's popular in the UK, but in Australia, we've got brands like QV is very popular. Cetaphil isn't great.
Okay.
CeraVe is quite good.
We've got CeraVe
Um,
here, I think.
yeah, I'm,
I
I'm
think
I'm
what we
trying to think
have
of
here with the
another.
pH. Um,
Yeah, it should say
CeraVe.
low pH. I'm
But
trying to
it
think
does
of
say it on the
why.
bottle. Is there
Yeah,
is a brand
it
that
should
I
say.
yeah, it does say on the bottle,
Yeah,
doesn't it? The pH.
it should say so the skin pH, just as reference, is around 5.5. So it's
Okay.
not very acidic, but that mild acidity is often enough to discourage the growth of bacteria and fungus and viruses. So drop some acid on your skin, which, by the way, is
Nice.
why certain acidic soaks can be helpful. Not necessarily very therapeutic, but things like vinegars to soak one's feet in for, let's say, mild tinea pedis slash
Yeah.
athlete's foot slash fungus can be helpful,
Can be. You're
but it's
right.
not often, but it also can be irritating because it's quite acidic, and some people can develop, and I've seen natural remedies, man, so often I'm correcting people's myths on natural remedies. I had one patient recently. She read, of course, on the ever reputable medical journal YouTube, that she could fix up her fungal nail infection with oregano oil.
Wow.
I
It's
mean,
like a
yeah, well, I mean, aside from walking into the clinic smelling like pesto, she managed to completely peel off her entire toenail, and it took
wow.
months to grow back. So, yeah, sometimes natural isn't always good. So,
Mm.
only under medical direction should one attempt things like vinegar and oregano oil. So hopefully that
Right.
hasn't put you off. Hopefully that hasn't put you off your pesto pasta. But yeah,
Absolutely not. No.
I'm sorry. What was the question? We're going off on a slight.
Go
Covered
on to
lots
the
of things
next.
there, Gator. I'm sorry. Yeah,
What's the most satisfying skin transformation you've helped a patient achieve on the lower limb?
it's a good question. I'd say probably the ones that are most symptomatic. So, psoriatic lesions, for example,
Mhm.
eczemas, but warts in particular. I mean, I've had patients with, chronic, long-standing warts that they're very self-conscious of,
Yeah.
um, just because of their catchiness. I had one patient. It took us about 3 years to clear up her wart. I had another interesting case of a patient um, who was vegan for religious reasons, and his feet were covered in warts. And we got him to increase certain vitamins, and we also treated the warts locally and cleared up within a matter of months. But I'd say probably the most satisfaction I get is when patients have clearance of fungal nails. That is really satisfying because there's a certain psychology with gnarly nails. It's probably, all those years of Hollywood indoctrination of the evil witch with those awful
Little
nails.
nails.
That's it, the gnarly nails. But yeah, when you have a patient successfully treat a fungal nail infection, it's incredible. There is a lot of self-consciousness associated with that.
There
Yeah.
is a massive amount, actually, more than people care to believe, really. So yeah,
Mm.
and it's time, isn't it, as well, clearing up fungal nails. It's whether somebody you have to get them to understand this is not an overnight fix. It's going to take time, but
No,
seeing the difference over
months.
the months, yes, um,
Yeah.
and that's it, isn't it? It's months of change, but you get there in the end.
Yeah,
You
months.
can get there in
You
the end.
do, you do, you do, you do. And to fully grow a nail out can take anywhere between 6 and 12 months, depending on the individual.
Yeah,
So it's always a tough conversation to tell your patient, yes, we'll probably get there in half a year to a year. Most
yeah,
people want results with next week.
yeah, and then
So yeah,
yeah, they're committed for the first,
yeah.
couple of months, and then because they've not seen a significant change,
Mm,
treatment seems to bow out a bit. So yeah, it's
right.
disheartening because stick
Yeah,
in there and you can see a huge difference. I was going to
absolutely.
sorry, Don, sorry, Joseph.
No, no, go on.
I was going
What I
to
was going to
touch.
say was,
Oh,
I'm
no,
sorry,
go
we're
on, go
jumping
on.
around a bit, but what I was going to say was like specific for fungal nails, one feature that I found really helps people stay on course is actually taking a photo of it once a month. I mean, we're tethered to our phones anyway. So take a photo of it once a month. And then if after 3, 4, 5 months you still think you haven't made any progress, just check through your reel and you'll be able to see that you probably have made more progress than you realize. But if you're looking at it every day, you're not noticing it.
No, you're not. And that's one
Yeah.
thing going forward that I've decided to do with my clients. I used to take a photo at
Mm,
first appointment. So you can look back on it. Then you slip into
mm.
not doing that, especially when somebody's coming in feeling really uncomfortable about their feet. I don't want to whip my phone out to take a photo. But now going forward, I'm going to do that because there's so many changes I've
Absolutely.
seen and missed that opportunity
Mm.
of recording that, if that makes sense. That yeah, so I'm going to at first appointment take that photo and be, and I think if we all took that photo 6 months down the line, when you feel that you're not making any improvement or the patient feels they're not, you've got that always to look back on then, and that stays on their file. It doesn't need to stay in your phone reel either.
Correct.
So,
Yeah, correct, correct. Yeah, although if it does stay on your phone, no one will touch your phone ever again.
no, they
Because once they see the picture, they my kids are like, seriously, Dad, seriously.
don't.
Yeah.
It just brings me to talk. I want to just touch on a little bit about gut health, but I don't want to go too much into it because I know this is a systemic issue completely. And we're hearing more and more about gut and skin connection these days. How might the gut show, your gut health show up on your feet, foot and leg problems? But I'm going to pinpoint it to foot and leg problems, but I do know that it's a whole
Yeah.
systemic problem.
Yeah. Well, yeah, I mean, a lot to unpack there. So, firstly, the skin is an organ, and no organ is an island, meaning that organs talk to each other and they interact. So, if we know that you are what you eat, if you're not eating the right things or you've got some sort of gut issue, that's going to manifest in other organs, including your skin.
Hmm.
It doesn't necessarily manifest specifically in the foot or the lower
No.
limb, but but if we get back to that patient that had that chronic wart condition, because they weren't eating enough of a specific thing, they were immunosuppressed, and therefore they were much more likely to develop warts and to not clear them effectively. But we do know that the science supports the idea that improving your gut health does improve your skin. We're not quite at the stage where, oh, you've got psoriasis here, just eat this specific thing and everything will get better. There's
No.
a heck of a lot of anecdotal. If you go deep into Reddit or TikTok or YouTube or any other social media thread, you'll see people that cured, in inverted commas, their skin condition by eating or not eating or taking certain supplements. It's really part of a bigger picture, which
Yeah.
again comes back to the initial point about the idea of it being an organ. So because organs are complicated structures, for example, the skin has 3 layers. Each of those 3 layers has unique cells and unique functions. So even within an organ, there's organs within organs in that sense. I mean, you think of the difference of even just looking at your fingernail now. I mean, look at the difference of structures around one tiny little area of your thumb,
Yeah.
and you realize that it's not as simple as, oh well, I'll just get off gluten and I'll be able to fix my skin condition. But that is to say that if you do have a chronic skin condition anywhere on your body, it is worthwhile at least exploring dietary factors, which I think would make a wonderful future podcast, Gaynor. So we
Absolutely. I was just
can,
about to say it's going to make a wonderful future podcast. Yes.
yes. So yeah, so definitely something to think about in the future. So yeah, general advice. If you're suffering from a skin condition that just isn't quite clearing up, it is worthwhile exploring your diet and your gut health with a registered professional
Yeah.
and seeing
That's
what sort of a
important,
difference it
isn't
can
it?
make.
Yeah, that's
Yeah.
important with a registered professional. It's very important. Well, you've already just said about the oregano. Is there any other weird home remedies that a patient's ever told you they've tried? Of
I'm trying to think. I'm trying to think what
course
else
there
sort of
is.
comes. Well, we've covered urine and oregano and vinegar. I'm trying to think what else there is that's out there. I mean, you do hear weird kind of stuff. Warts in particular. The reason I think I see the weirdest thing with warts is because there isn't one perfect treatment for warts.
No, there isn't.
So warts are caused by the human papillomavirus, of which there's over 150 subtypes, meaning that the wart you have on your hand or your foot or anywhere else for that matter could be any one of those subtypes. And so not every treatment works on every subtype. And so as a result, we kind of in many chronic cases we have to cycle through different treatments. So you develop some weird things that you see. Some people, particularly in pediatric cases, where they get the pediatric patient to draw a picture of the wart and then destroy it and throw it in the bin.
Wow.
You can sell your wart to your gran for for a
I've
dollar or something.
heard of that as a
Sell the
child.
wart, a psychosomatic kind of thing. I mean, I'm trying to think what else I've seen that's out there. I did have a patient recently who had knee and ankle osteoarthritis, wrap her ankles and knees up in tinfoil, which was quite
Oh,
interesting.
did it
Yeah, she
work?
she swore. Well, no, but she did feel better that she wasn't absorbing as much Bluetooth, Wi-Fi, or 5G radiation. So it's always that's always comforting to know. At least she wasn't wearing a tin hat. But no, I think I think when it comes to weird remedies, the less clear pathway we have to fix something, the more kind of folk kind of stuff creeps in
Yeah.
there. I mean,
Yeah.
I'm sure COVID wasn't that long ago that we don't remember, people having bleach and
Yeah.
ivermectin and all sorts of other crazy.
Yes.
Yeah,
It's
that was a
loads.
fun time. That was a fun time for all sorts. But yeah,
It
no,
was
I can't
actually.
think of a. Yeah, I can't think of one off the top of my head. But every so often I'll get one in there and I'll be like, wow, that's a first. I should probably make a list of weird
Could
remedies.
write a
I
book.
should.
I
I
bet if
will.
you thought about it. If you thought about it. How is the
I have.
field?
Yeah.
Oh, how is the field of podiatric dermatology evolving? And are there any emerging technologies or treatments that you're really excited about?
So dermatology as a field as a whole is
Yeah.
is always evolving. I mean, every branch of medicine is evolving. So when it comes to chronic skin conditions like psoriasis and eczema and other weird, you know, um, irregular ones, biologics are absolutely massive. Biologics are basically they're really cool molecular complexes that are engineered through telling cells what to do. So
Okay.
normally the way they test drugs is they basically stick a bunch of chemicals together. They test it in different models. Eventually they go into human model, they start with animals, human models, etc. And normally they're quite small sets of molecules stuck together. We'll just put a figure on it. Let's say up to 40 molecules. Biologics are big complex molecules that can be 200 plus, big structures that basically target specific areas of specific cells that have very little side effects. And they're using it on crazy cool things like cancer, Parkinson's, Alzheimer's. So if you look into biologics, you'll see some incredible
Right.
research within that area. And within dermatology, we're seeing breakthroughs like, psoriasis treatment can be fixed with 3 to 4 injections per year with a biologic, as opposed to having to put
Wow.
on a cream every single day or take a tablet that
Take-
gives you nasty side effects. So
Yeah, yeah,
biologics are massive,
yeah,
and
that's going to be a
yeah,
breakthrough, isn't it?
incredible.
Definitely.
Well, they're here already. Some
Yeah,
of them would be available. Like I mean, I'm not that familiar with the way the NHS works,
yeah,
but they're certainly available. They're certainly available in the UK, in Australia, in the States. Most of the world they'll be available. So
yeah.
that's huge, and they just keep improving.
Keep improving.
The second area that's huge, as we know, is AI. So
Cheers.
AI, but AI and dermatology have really been, I suppose, strange bedfellows for at least a decade. Because when it comes to looking at particularly malignant skin lesions, so we're talking skin cancers, AI has been better than the human eye for the past decade, at least.
So I
So
didn't know
what we're
that, really?
yeah, it's been better because there's only so much the human eye can see.
Yeah.
And there's plenty of really good scientific research that supports the use of AI in lesion detection. So what we're finding is, particularly for skin cancer screening, AI is now a companion. It's basically part of many dermatologists' assessments. So eventually we'll get to the point where you'll pretty much just have, well, we're at that point already, but we'll be able to use AI for pretty much any skin lesion. In fact, Google Images is now developing an AI tool, meaning you'll be able to upload a photo of your skin lesion into Google Images, and it'll say,
Wow.
right, it's very likely that this is just a pimple. Here's some suggestions for treatment. Here's some local practitioners in your area that can help with it. I mean, I used it, for example, I used an AI code source,
Yeah.
and I got it just to look at like a little scar that I've got here on my, just on my palm there. And it said, well, you're a male in your early 40s with Fitzpatrick type. Fitzpatrick is the level of pigmentation. Fitzpatrick type 2, and it's 70% likely it's a scar. It's 20% likely it's an old verruca. Like incredible detail, literally just with one photo. So AI is here, and it's going to make our lives easier in many ways.
Yeah.
Of course, as long as it's used properly and in the
That's
right
the thing,
hands.
isn't
But
it?
that,
Yeah.
yeah, but that's going to be huge, and AI will work with things like biologics to create better drug targeting. So that's going to be a big
That would
breakthrough.
be,
I'd
yeah,
say
huge.
I'd say by the end of the decade, we're gonna have a lot more advancements in skincare, and we'll be able to personalize skincare a lot more. We're getting better at that as well. So I touched upon it a little bit with the gut skin axis
Yeah.
and relationship kind of thing. We'll be able to get to the point where, by the use of all this new technology and also having a knowledge of your genetic data and information, we'll be able to just say, right, because you're this age, this gender, this genetic predisposition, living in this place, etc. This is exactly what you need to do in terms of your diet and lifestyle measures to fix your X health problem. It's going to be, so we're not just talking dermatology, we're talking all the other factors in terms of someone's health. So yeah, we're just
Absolutely.
really at the
Yeah.
dawn of a new age in medicine, with all those technologies synergizing.
Yeah.
Hopefully.
Yeah.
Yeah.
Hopefully. Um, Joseph, finally, if you could leave our listeners with one key takeaway about caring for the skin on their feet, what would it be?
It would be, as I mentioned before, just really good hygiene. Good, like get the basics right. So good hygiene, good ventilation, help the skin help itself. The foot is not supposed to be closed inside a shoe and a sock for 12 plus hours a day. So keep it clean, let it breathe, moisturize according to your needs, and even just keeping to those basic health foundations, you'll notice even the most chronic skin condition will improve. So yeah, that's my little pro tip.
Yeah, no, I think it's a brilliant pro tip. Okay, Joseph, thank you for coming and sharing your knowledge today. I know where to find you because I've been following you and listening to your work. Where can the
Yeah.
listeners connect with you and learn more about your work?
So I have a Facebook group. It is only for practitioners though. So unfortunately, if you're a member of the public, you can't subscribe to that. But if you're a foot health practitioner, practitioner or a podiatrist or a chiropodist or someone else within medicine, that's our Facebook group, which is called Podiatric Dermatology Interest Group. We're currently sitting 5,500 clinicians internationally. So
Right.
really, really great community where people share cases and stories and news and jokes and all sorts of other images that will, again, make sure no one will touch your phone. The other place where I do a lot of work where anyone can subscribe with different subscription options is my Substack. And that's just my name. So Joseph Frenkel, Joseph Frenkel, Frenkel.substack.com. So I do a monthly theme every month. Currently, we're actually talking about eczema. And so the first post of the month is free, and I'm trying to incorporate more content into that in between all the other million things that I'm doing. But yeah, and I did at one point have a YouTube podcast, but thanks to you, this has really rekindled my interest. So hopefully, I
Good.
might rekindle that once more. So yeah, stay
Brilliant.
tuned for that. But yeah, Substack and Facebook is where mostly you can find my work. Yeah.
Brilliant. Right. Okay. Thank you again. And take care, everyone. And most importantly, take care of your feet.